many ways, we study these patients in a very archaic way by pulling out individual things to look at. And so, do you think there's huge opportunities here linking AI and the critical illness space?
The reason why we wanted to have these talks is to really stimulate some discussions around intersection of CIIRRC and AI and what kind of things we can do, and it's going to be really, really important.
We use AI and computational models to detect different clinical events, including the diagnosis or need for intervention. We use these models to characterize the lifetime clinical risk associated with different disorders and also identify risk factors, modifiers, and predictors of these different outcomes.
Profound opportunity here across our enterprise, across our market, to really understand a lot of problems, but certainly this problem better. You know, a lot of this data has been generated from administrative claims data, which, as you all probably know if you're health outcome researchers, and that leaves a lot to be desired. It's based on diagnosis codes, administrative data. Like I said, it does not capture physiologic variables. But as you heard Dr. Gherkin say, that's an opportunity here. That's a real opportunity within the system.
So we can also use that for monitoring and healing process of different diseases. For example, we have devices for monitoring knee joint, or we can use these for traumatic brain injury. We make wearable devices for traumatic brain, and potentially we can make devices to find spinal cord injuries and eye injuries. And these are low cost, accessible, that patient can use it, primary care doctors can use it.
So there's some real opportunities here. Eventually we think that each patient can have their own unique expected high sensitivity troponin value.
And then basically what you would do with that is each patient would then have their own individualized 30-day risk for cardiac death or heart attack reported within the EHR that would be actionable for the clinician.
That we embedded our deep learning models, and we are able to retrieve ECG data from a number of wearables like Apple Watch, Fitbit, and others, and then we are able to deploy these models on edge devices.
I think a machine learning approach to the changes in these variables may add additional predictive value over a multivariate regression. I'm interested in knowing if this averaged waveform has any additional features that could be identified by an AI algorithm.
Collaborative sessions provide a really wonderful opportunities for AI researchers to learn more about the clinical needs of patients and challenges that physicians are experiencing in providing care for them, and also for physicians to learn more about new technologies and how they can incorporate them into their own practice. I believe there are many areas for collaboration between Center for AI and Center for Critical Injuries that can significantly improve patients' health and patients' health outcomes.